Hi everyone, I'm Hartford Healthcare's Tina Verona. Well, managing your weight can be an uphill battle, very challenging for many. Joining me is Dr. Devika Umashanker. She's an obesity medicine specialist with the Hartford Healthcare Medical and Surgical Weight Loss Program, and she joins us now. Thank you so much for being here. We appreciate it.
Thank you.
A lot of questions to get to. There was an article online leading up to our Facebook Live, and folks have been emailing a lot of questions in about weight loss. So we want to get right to the first question. This was sent in by email. There is so much to gain through medical and surgical weight loss. What sets this program apart?
Absolutely. So what sets our program apart from other programs is the fact that we have a medical arm attached to our surgical program. So individuals that may require preoperative weight loss or may have post-operative weight regain, they can be well assured that they do have another physician in the program that can help assist with that process.
Yeah, and I think that's so important because after weight loss surgery, the follow-up is critical, and that's where you come into play.
Absolutely, absolutely. You want to make sure that you're continually following with your clinician to make sure there's no challenges you're having after the surgery, whether it be any complications or weight regain or weight plateau, and that's where we step in.
Yeah, absolutely. We have another question. We've heard a lot about this being the easy way out, but it's really not. What do you want to say to those people?
You know, I think that with weight loss itself is a challenge, and I think going through a medical weight management program or a surgical weight loss program is definitely not the easy way out at all. And those who have done it in the process earlier can attest to it. It takes motivation, it takes time commitment, and those people should know that this is a lifelong journey.
Right, and after the surgery, really that's when the work just begins. And you come into play to sort of guide them through that journey afterwards. Tell us a little bit about your role in terms of nutrition and how you keep them on that right path towards success.
Absolutely. So after someone comes and sees me, we try to set up a plan, an individualized plan for each person, because what we do know is everyone has a different medical history, and as a result they may be on different types of medications. And what we do know is there's not one diet that fits everybody, and so we try to put together a plan where it fits their lifestyle, is appropriate to their medical history, and we recommend continuous follow-up. Our follow-ups are anywhere between 4 to 6 weeks. We ask them to come see us regularly for the first 6 to 9 months, because what we do know is those who come and see us regularly in that time frame have the most success in terms of their weight loss surgeries and outcomes. And then after that 9-month period, depending on where they are in that trajectory, I may ask them to come follow up with us every 2 to 3 months afterwards. And then we just continually follow up with them, because what we do know is we're there all the time and we are available as much as they need us to be.
And we are getting a lot of questions regarding surgery, which you work closely with the surgeons, Dr. Tischler, Dr. Papasavas, the surgeons, and then you kind of come into play after that. But we do have a question about that. Is there a minimum age requirement for bariatric surgery?
Sure, absolutely. That's a great question. So there is. We ask people to be 18 and over for their minimum age requirement.
Okay, another question. Can you have the procedure while pregnant? Interesting question.
Yes. So the recommendation is to not be pregnant while you have the surgery, and to wait a year afterwards to get pregnant after you have the weight loss surgery.
Another question. How invasive is the procedure, and will I be left with scarring? There are minimally invasive procedures now with weight loss surgery.
Absolutely. So there are some scarring, but not extensive scarring, very small scarring that one may see, and you will be following up with your surgeon afterwards if you have any issues or concerns with it.
Yeah. Another question, how long will it take to start to see results from the surgery, and is there a risk of regaining weight later, and that's where you come into play?
So that's a great question. So how early can you see results from surgery? I would say anywhere between a month to 2 months you can start seeing significant weight loss afterwards. Is there weight regain after surgery? So studies have shown there is weight regain where someone can gain about 3 to 5% of their weight loss within 3 to 5 years actually. But everyone is different, and how everyone responds to surgery is different. I have seen people anywhere in the spectrum between 3 years after having surgery and 10 years after having surgery. And that's when you come and see me, where I can try to see what the challenges have been in terms of nutrition, or has it been exercise? And if all of that is in place, do we see a role in medications for weight loss?
Right, and let's talk about medications for weight loss, because there are a lot of supplements out there, a lot of dietary supplements that we'll get into as well. But what about medications? Because this is really your area as well.
Yep. So in our practice, we utilize FDA-approved weight loss medications, and we do also use medications that are FDA-approved, but an off-label approach for weight loss as well. When individuals come and see me, somewhere in their history, they may have used a product over the counter or still using a product. And to those individuals, I highly recommend, when you do use a product over the counter, just make sure that, these products don't have to go through the FDA regulation medications have to go to, so we don't know what's in the ingredients exactly. I recommend people not to start anything over the counter, use any supplements till they speak to their primary care physician.
And I think too, for a lot of people, when they see over the counter, they think it's safe and they don't need a doctor, but you disagree with that.
I absolutely do, for the very same reason that these supplements and products don't go through a very tough regulation process, and you don't know what can affect you based on your medical history. So you always want to make sure, if you start something new, speak to your physician so they can actually kind of review the ingredients with you and see if it's really appropriate or not.
The topic of diets, and there's so many diets out there, the keto diet, the paleo diet, the Mediterranean diet, all of these diet crazes out there. What is your take on that? Which one is good? Which one? What's your thoughts on the diets?
So I love this question because I think it's such an important question, because many people have one time or another been on several diets and seen something that doesn't work. So there was actually a study that was done on this and looking to see which diet is best for patients. And what they realized in that study is it didn't matter what diet people were on, it's a diet that an individual can adhere to.
Right.
So usually when I talk to my patients and they come and see me, I ask them what diet has worked for them in the past, why they were able to still be very motivated to stick to that diet, and see if it's an appropriate diet for them in terms of their medical history, and see if we can design a diet very similar to that. And that can be any diets that we use in our program, whether it be a low glycemic plan, whether it be a Mediterranean plan, and there is a space for a ketogenic plan as well, depending on people's medical history.
In case you're just joining us, we are talking with Dr. Devika Umashanker. She's an obesity medicine specialist here at Hartford Healthcare's Medical and Surgical Weight Loss Program. If you have a diet-related question, a nutrition-related question, we encourage you to ask her. Back to sustainability and diets. A lot of people will have success with certain diets, but then maybe, after they're off that diet and they've achieved their goal weight, they gain the weight back. How do you sustain the diet and sustain success going forward?
Yeah, so that's a very common challenge that I see with our population, where they've been on a diet in the past, lost a significant amount of weight, happy with their weight loss goal, and now they're off the diet and they regain back the weight. So I think what we need to understand is there's some sort of physiological process that occurs when people have regained a weight after they get off of the diet. And one of the biggest things that we've seen in our studies is that your metabolism significantly goes down when you lose weight. And unfortunately, if that same diet is not in place or exercise is not in place, we do notice significant weight regain as well. So how do you maintain sustainability? My recommendation would be, if a diet works, you have to have these long-term motivations, self-motivation that says you have to be on this diet for as long as you possibly can, and incorporate the exercise as well. Otherwise, more often than not, you do see a weight regain. And that's why I tell my patients, those that are on a very low calorie diet or on a meal replacement diet, they have to really look at themselves and say, is this something that they can sustain for a long time? If not, where we can help them.
Right, right. So critical. And for when speaking of metabolism, for women, as we get older,
Yep.
our metabolism changes and it's harder for us to lose weight. Easy to gain, harder to lose. What is your advice to women out there who are getting older and maybe finding it not so hard to lose the weight in certain areas?
Yeah. So unfortunately, women do tend to have more fat tissue than muscle tissue compared to our male counterparts. And as a result, we do tend to gain more weight comparatively, especially when we hit certain milestones in our life, whether it be pregnancy, whether it be menopause, and that's when I see individuals having difficulty losing the weight. What would be my recommendations for them? We have to see, it's difficult to say there's one recommendation. I would say you have to really look at your food log, see where the issues are, and then see where your activity level is too. But sometimes it's just not exercise and activity. We also know lifestyle, for example, stress can hold on to weight. We do know individuals that have just started new medications can hold on to weight. So it's I would recommend for women who are having challenges losing weight after a significant event to really speak to their primary care physician so we can identify areas that could be the challenge and see how we can help rectify it.
And when we talk about diets, the patients that usually come to see you are either, pre-surgery or post-surgery, and oftentimes other metabolic issues, maybe diabetes or high blood pressure plays a role, where dieting is so critical to have that, somebody like yourself monitoring that, because for somebody with diabetes or high blood pressure or high cholesterol, that can really affect that depending on what your diet is if you start, say, a Mediterranean diet or something.
Absolutely. So, for example, individuals that come see me that may have a history of type 2 diabetes, when we do recommend a low glycemic plan for those individuals, I have them come and see me quite often because you also have to monitor their medications. And what we do know is, for example, people that are who have type 2 diabetes may be on insulin. And if they have such significant weight loss with just the diet itself, we have to make sure that their insulin is adjusted accordingly, or even remove certain medications used for diabetic control that are oral therapy. Remove that as well to make sure they don't become too low in their sugars.
Right, and can their medications, their prescription medications, if they're taking over-the-counter supplements, that can create interference?
Absolutely, absolutely, because we don't know what, like I said earlier, we don't know what's in these ingredients, and we don't know how they may affect their blood pressure, how they may affect their glucose metabolism. So I usually recommend that when patients come see me, bring all your medications or bring a list of them so we can have a very tight control and know what exactly you're taking and see when you have that weight loss, which ones we should be removing in a stepwise approach.
What is your take on dietary supplements?
Yeah, so I am not a big fan of dietary supplements, only because I've seen what the research has shown and seen how it can be dangerous in our population. So my take on that is, if you're really interested in starting a supplement for weight loss, speak to your provider. There is multiple FDA-approved weight loss medications that are available, safe, that you can utilize to get to your goal.
Let's talk a little bit about BMI. A lot of people don't know what BMI is, of course, body mass index, but explain that and where people should be and how important knowing your BMI is to your weight journey.
Yeah, that's a great question. So we use a body mass index to help us identify individuals that are having challenges with weight. So what is a body mass index? It takes your height and your weight into calculation and tells us where you are in this trajectory of weight goals. So we have a normal weight, which is less than 25. We have people that are considered overweight, between about 25.1 to 30, and then we have our obese range, which is from class 1 obesity is separated from 30 to 34.9, class 2 obesity is 35 to 39.9, and class 3 obesity is greater than 40. But I also say this, body mass index itself is not the best tool. You have to also use, in our practice, we use a bioimpedance machine that shows us what your fat mass is in relative to your fat-free mass. By fat mass, I mean how much fat tissue you have. Fat-free mass, I mean how much muscle, how much ligaments, bone weight, how that all plays a role. So I use both of those calculations with my patients to say, this is how much weight you should lose. Because what we do know is there are, for example, back in the day, Arnold Schwarzenegger at his youngest age when he was the bodybuilder, he had a body mass index greater than 40. So we would all classify him as obese.
Right.
But his muscle mass was very high. So would he be appropriate for our program? Absolutely not.
Right.
So I use both of those into calculation when I actually develop a plan for my patients.
So really body mass index is important, but you use it loosely because of the muscle factor as well.
Absolutely. And this type of scale is not available at all practices. So that's why I say it would be great if someone's looking to go on a journey of weight loss to identify an obesity medicine specialist, because most of us have this in our practice and utilize it to develop a plan.
Interesting, yeah, because that could make a difference of whether you're obese or not.
Absolutely.
And some may think that they are, but in actuality, they're not.
Absolutely.
And vice versa.
Absolutely.
Too. Let's talk a little bit of calories. Calories, caloric intake, it's so, a lot of times, oftentimes you'll see on menus, there'll be, a salad has 800 calories. What is the normal caloric intake that people should be getting a day? You hear so many conflicting numbers, and what are you saying, or what do you think?
So I think that's a great question, and that's also a very difficult question to answer, because I say that only because I, in my practice, don't give patients a caloric range to abide by. Only because what I've seen is sometimes when patients have a heavy meal for breakfast or lunch, they think that entire day is gone for them and then tend to indulge later on in the day. So what I tell them is, I give them parameters and recommendations of what you should be eating, what can be unlimited in terms of like vegetables, what you should be watching on what you eat, even in terms of fruit, and kind of stick to the recommendations of, if you want to do a breakfast and you're looking to see how much you should be eating, have a high protein breakfast. Because what we know is the high protein breakfast kind of sets the tone for the day. And in some studies, we've seen that a high protein breakfast can prevent overeating later on in the day as well. And the same thing goes with lunches. I try to recommend a more high protein, moderate carb or fat intake as well. But in our practice, we don't recommend a particular count of calories. But other practices sometimes do. But you've seen success in both.
Right, of course. When it comes to dieting, nutrition obviously goes hand in hand. A lot of people will say, oh, I have to cut out carbs, I can't eat carbs, or I can't have dessert. Do you... And of course, everything is in moderation. And I think that at least, for a lot of people, that they're not successful because they cut out carbs. Do you recommend doing that? Is that too extreme, or in moderation?
So I really believe in moderation is key, so people don't feel deprived, and then people don't start resenting the plan that they're on. So one of the recommendations I do make to individuals, and this was actually studied at Cornell, in terms of how you should eat your meals and how that can impact weight loss. So individuals that come and see me, they say that they love carbs and they can never give it up. And I tell them that that's fine, you don't have to give it up. You just have to eat it differently. So one of my recommendations for my patients is always to consume your protein and vegetables first, wait 15 minutes, and then have a carbohydrate, whether it be a starch, whether it be, pasta, bread, whatever they may like. But the key is you have to wait 15 minutes. And the question is why? Why do you have to wait 15 minutes? It takes that long for you to engage in hormones that promote fullness. The same hormones that are produced in surgical weight loss. Obviously not in the same robust amount, because this is more of a method of eating and this is not surgery, but you're still engaging in that hormonal production.
Right.
But at the same time, you're able to consume what you like.
Right.
So moderation is key. I'm a big believer in, utilizing and incorporating protein, fats, and carbs in your diet to have a healthy, balanced meal.
And for those who are going to be having weight loss surgery, that's another important part, because where diet comes into play, because you have to lose a certain amount of weight before you have the surgery. Is that correct?
So it depends on where you are in your body mass index. There are some people that don't require to lose some surgeries. I'm sorry, lose weight, I apologize. And there are people, if you have an elevated body mass index, for example, greater than 60, we do recommend that you get closer to a body mass index to 40 to help optimize your weight loss outcomes.
So the folks that may be preparing for weight loss surgery, what should they be doing? What do you tell the patients to do in terms of how to prepare, what foods to be eating, and that? How do they prepare for the surgery?
So that's a great question. So individuals that are getting ready to have surgery, they, within the program, the surgical weight loss program here at Hartford, they have a very multidisciplinary comprehensive team. Well, they'll be working with the bariatric nutritionist, following up with them on a regular basis to make sure that they're on track for their surgical weight loss outcomes. They also get to see our behavioral therapist to see if there's any issues or complications that need to be discussed, and visit our advanced practitioners regularly prior to surgery to just identify any challenges that they're having. If not, see how well you're doing.
Yeah, and what is the sort of the secret to the success post-surgery? What would make a patient successful in keeping the weight off?
Yeah, that's a great question. So I would say definitely incorporating everything that you've learned prior to the surgery, the nutritional recommendations, the exercise recommendations, and following up with your provider after the surgery. Because more often than not, I see patients who haven't seen a provider since their surgery in 3 to 4, 5 years, and now have regained the weight back and are rightfully so frustrated with the process because they've just had a major surgery, several years later. But I tell them it's so important, because what we do as providers is identify area as soon as you start regaining the weight or having weight plateau.
And I think it's probably so important with you when you see patients is to really put it into context that surgery is just a tool in the toolbox to lose weight. It is not the magic. I think when it comes to weight, people look for that magic pill or that magic solution, because it's difficult to do, and I think it's even more difficult to maintain your goal weight.
Oh, absolutely. I think weight maintenance is much more challenging than weight loss itself. Even studies have shown that if you wanted to have weight maintenance, you have to exercise 240 minutes a week comparatively to the 180 minutes that they have for weight loss. It takes more on your end to have the weight maintenance, but we're here as your providers. We're all on the same team. We want you to be successful.
In it together, in it to win it.
Absolutely, absolutely.
When it comes to exercising, you hear at least 30 minutes of like a brisk walk or cardio a day. Do you believe in that, or is more or less?
Oh, so what I'd recommend is from what the American Sports Medicine recommends in terms of how many minutes you should be working out. 150 minutes to 180 minutes a week is what I recommend. That can be divided anywhere between 30 minutes 5 times a week or 6 times a week. And then I have patients that come and speak to me and they ask me, I don't have time. I can't exercise, my life is busy, what do I do? So I always reference this one study that I think is great. It's the Weekend Warrior study that looked at individuals who exercise twice a week versus individuals that exercise 5 times a week. And do they get the same cardiac benefits? Because at the end of the day, when we're looking to lose weight, why are we doing it? We want to be healthy. And what they noticed is, even if you exercise twice a week, you still get the same cardiac benefits as 5 times a week, but you got to hit the numbers.
Right.
You got to hit the 150, 180 minutes a week.
Yeah, that's tough.
That's tough. It takes time commitment. But I feel like if you know that this is a lifelong journey, the time commitment is not so bad.
Right, and having you guys on their side is not a bad thing either, so to give that little extra push when you need it.
Absolutely.
Dr. Umashanker, thank you so much
thank
for
you.
joining us. We appreciate
Thank
that.
you.
And thank you for joining us. If you'd like to learn more about the medical and surgical weight loss program here at Hartford Healthcare, you can call 1-855-792-6258 or log on to whatwillyougain.org. Thanks so much for joining us. I'm Hartford Healthcare's Tina Verona. We'll see you next time.